Hello, everyone. Thank you so much for joining us today for our parent and family orientation webinar for wellness at Duke. We're super excited that you all could be joining us live. And if not, this webinar will be available within 48 to 72 business hours as well for you to go back. So to kick us off, I'll start off with some different housekeeping items for us today. So you will notice that your chat function has been disabled. However, at the bottom of your screen, you will notice that there is a Q&A feature. Feel free throughout your presentation, if you have any questions for us, feel free to drop those questions in that Q&A. We also do want to advise that please do not share any personal of your student information in that chat because that could be live to all of the attendees or in our recording. So please refrain from putting your students' personal information in that chat. We do also advise we'll have multiple presenters throughout this webinar today. So feel free, if you think your question may be answered, we encourage you to wait till after each of the presenters is finished and then going ahead and submit your questions after each of the presenters. Lastly, we will be answering some of those questions, like I mentioned, live or via the chat. And this webinar, again, is being recorded and will be accessible via our webpage within 48 hours to 72 business hours. So without further ado, I will go ahead and kick us off and introduce you to the Assistant Vice President of Student Wellbeing, Libby Skiles. Libby, thanks for joining us this evening.
Thank you so much, and good evening, everyone. Or good afternoon, depending on where you are. We're looking forward to being able to have a conversation this afternoon about well-being and have a range of partners joining us this afternoon, and I'm excited for you to get to hear from them. But wanted to just kind of touch a little bit on well-being at Duke and our work to create a system of support. So you're going to hear from a number of partners today. But this is just a few of the departments and areas that really help us create a structure and an environment and processes to support your student while they are at Duke. So, in addition to student health, counseling and psychological services, student insurance, the DuWell and health promotion team, and DukeReach, who are all going to be talking to you this evening. We also have a range of partners in student affairs, in our housing and residence life area, our student involvement in leadership, identity and cultural and career centers, as well as a range of other campus and academic partners who are all invested in the well-being of your student and in their Duke experience. And that may mean a range of things, widely varied aspects of well-being because we know it's multidimensional, but you're going to hear that thread throughout interactions, hopefully as you've been coming into Duke through the admissions process, through the summer, and now going through the last 30 days, as we now realize, before it's time to start at Duke, and we can welcome you to Durham. So just want to share that piece and create the context for well-being here at Duke. And to kick us off with a little bit more in-depth overview, going to turn it over to Dr. Melanie Trost, one of our physicians in our student health area.
Hello, good evening, everybody. My name is Melanie Trost, and I am a family medicine doctor. I've been here for the last 20 years at Duke Student Health, and so I'm pleased to participate in this webinar and hopefully give you guys a lot of good information about how student health operates on Duke's campus. So this is a picture of our beautiful building. And it co-houses the student health facilities and our counseling and psychological services, as well, nutrition and physical therapy and a dentist's office. There's a lot of action going on in this building. And you will see by the next slide that it is beautifully centrally located. So we are the purple star down there in the left hand. The Chapel West Campus, that the chapel is usually a good orientation marker for people, is the blue star. And this really is just to show you all that we are in the heart of the West Campus area. The red star is the emergency department in the health system main hospital complex. So that main hospital complex is also very close, right in the hub of Duke. And then over to the right, you'll see that is the East Campus block. So it's all easily accessible for the freshmen that spend most of their time on East Campus. It's a little bit of navigating, but all of those students are going to be used to coming over to West Campus and to the unions and to all the centers in West Campus and their student health nicely centrally located. Next slide. So just to let you know that we are serving as a primary care office, and we have kind of general primary care office hours, daytime hours. We take time for staff meetings and continuing medical education on Thursday mornings. So we have a slightly later opening on Thursday mornings. We are closed on Saturday and Sunday, but we are always available. There is always a nurse advice line, and our providers rotate through a call system. So if a student needs to call student health after hours, then that's an option, and we can connect them to appropriate care. Next slide. So we do provide comprehensive primary care. I love the niche practice that is the sort of a young adult, and we take care of the undergrads as well as graduate students, law students, all the cadre. So we do have some focuses because young adult medicine, we have brought in kind of an expansion of service to gender care, women's health, sports medicine, travel medicine. These are things that young adults do, and we want to support our students in being healthy in those endeavors. We also have options to do that in telemedicine, and on site, we have basic laboratory services and radiology. So it's really set up, designed to provide the kind of appropriate care for folks in this age group. Here is a collection of our providers. So we have these primary care, again, family medicine, primary care focused, whole health focused clinicians. These folks on the top, Dr. Spots, Dr. Zhao, and I are here almost all the time and doing that care. And then we have some kind of subspecialists that come in and provide a little bit more support in areas that we know that we have a lot of demand in the student population. So we have endocrinology, women's health, gender affirming care, sports medicine care. So we know that our young students just need a lot, or require a lot of access to that type of care. So we've tried to design that to just be available on site. Next slide. If we can't provide the care, or it raises to a level of a specialist, needs a different level of service, we really would love for us to be the first stop, and then for us to be able to refer folks into our specialty care, quaternary care service. We do a lot of things. We do a lot of sports medicine. We take care of a lot of acne and eczema and dermatology, as those examples on the slide. But then if that exceeds what we can do on site, then we have great referral services. We have great ability to connect to the healthcare system at large. And I also do highly recommend, if you know that your student already has connection with a specialist at home is going to need a certain level of care, is going to need that kind of ongoing chronic illness connection, then gathering up that paperwork, gathering up kind of a summary of the care that they've done, bringing that to us. We get them kind of plugged into the system. We get them plugged into what they need in the healthcare system at large, build them a chart, kind of hit the ground running as they get here. So we do see patients by appointment, and that is available online through a health portal and as well through our main phone line. If anybody remembers what the letters are for their numbers anymore, I do because I'm so old. But 681-935 is 9355 is 681 well. So that is how that number was assigned way back in the day. But our nurses answer that line. If a patient isn't sure if a student isn't sure they need to come in, they can talk that out with the nurse. And then we have after hours as well, that the students can kind of process through, do I need an appointment tomorrow? Do I need to go to urgent care? What's going on with any particular student? Next slide. So we have this 24/7 nurse advice line. They just call the same number. That 919-681-WELL number gets them into an appointment, gets them to a nurse to chat out whether they need an appointment, gets them the office hour, the after hours connection. We do have providers on call if it's med refill, something that's just quick thing, or do they need to discuss something with their provider, or can triage into our urgent care or our main healthcare facility in the hospital system. Next slide. So we also provide nutrition services, and our go ahead and bounce to the next slide, because there is a lot of information available on our website about what the nutritionists do, how to navigate nourishing yourself on campus, connecting to the dining services, and kind of tips and tricks on how to stay effectively nourished while trying to be a smart student, ways to eat in a dorm, all kinds of great stuff that they have. Next slide. Also, immunization compliance is a major part of, it is a public health mandate that we have from the state of North Carolina. And it is a large part of what we do to supply effective care. We're putting students into a congregate setting, and so we want them to have all the appropriate immunizations. So next slide. You will see that you all already hopefully are aware the kind of summer we would like for you to have all of your paperwork in is kind of already going on. Then there will be a kind of hard deadline in September, but right now already all of you should be making sure that your students have filled out all of the information online before getting to Duke, because scrambling around for that paperwork after the fact just frustrates everybody. So if they can just get all that stuff done in advance, submit those forms to immunizations@duke.edu, and get everything submitted, then we just can check all those boxes, make sure everyone's safe on campus. Next slide. So that was a whirlwind, but really we are looking forward to welcoming your student to campus, and hopefully it's always an interesting thing. I hope that nobody needs me, but here we are. And if students become ill, if they need that connection to the healthcare system, we are pleased to provide care for the students and have a really great comprehensive team here to provide that. So now I'm going to pass this along to our friends at Counseling and Psychological Services. Nadia, I think you're taking over.
Yes, I am. Thank you, Dr. Trost. Hello, everybody. My name is Nadia Damani Koja. I am CAPS director, also a licensed psychologist. Welcome. Next slide. So again, just like Melanie said, this is the day view of our beautiful building. So pharmacy is on the first floor, just to orient you. The student health is on the second, and the counseling center is on the third floor with a great view. Next slide. Just throwing it in there just to show that this is what our waiting area looks like. The one on the left, top left, is one of our group rooms for students who might want to join the group. The middle one is just a resting wellness area. Then we have a couple of pictures of our waiting room. And the right bottom one is what a typical counseling room would look like. It's a beautiful building with lots of, natural light, and we love it. Next slide. So just to mention top stressors for our Duke students, we are IB plus, our students are brilliant, and they are also highly competitive, which creates a lot of anxiety, as you can imagine. So our top three stressors consistently for our students are social anxiety, generalized anxiety, which is really an anxiety that seeps through everything and impacts your functionality, and then, of course, the academic distress. A distant one is depression, and of course, the relationship and family stress. When you are working really hard and studying really hard, it is bound to impact your relationships. So these are some of the stressors we keep an eye out for, and create multiple services around that to support our students. Next slide. And just, I usually talk about this with families and friends and RAs and, campus partners. If you can click one more time, it will show, yeah, there you go. And so some of these, stressors and distress are very easy for us to notice, like academic performance, right? It's going to be flagged right away if they're not attending classes, if they're not showing up for their exams. So that is more like I would be informed right away. CAPS would be informed right away, either by an academic dean or, a dean of students in general. Physical changes, a little bit difficult to notice, but the best way to look at it is if anything is erratic, sleep or appetite changes. So our clinicians are well trained to, when we're doing triage, to ask about when was the last time you slept? When was the last time you ate? Because if I don't eat or sleep, uh, my symptoms are going to be diagnosable as well. So we make sure that we give like a wraparound, triage around all the basic needs and making sure that they are taking care of your overall well-being. Now, emotional and behavioral changes are a little bit difficult to capture. So at Counseling Center, we make sure that when we get in touch with a student for the first time or ongoing therapy, we kind of have a finger on the pulse, so to speak, right? If you are socially withdrawing, if you're not showing up to any socials within your dorm rooms, if you're engaging in risky behaviors, right? So what is going on? So we try and catch them in real time. And then sometimes, if things are not going well, it confusion, disorganized thinking, trouble focusing is a little bit of a higher care need. So then, we would do an additional intake for that. And of course, we are always paying attention to, safety concerns, talking, if the student is talking about nothing is going well, expresses hopelessness, right? So our clinicians are very good at catching all of these facets of what's going on with their daily functioning. And we try and work with our campus partners, whether it's DukeReach or DuWell or Student Health. We collaborate really well to make sure that if we're seeing this view, does anybody have like a different vantage point? So we try to catch that. Next slide. And this is just for you to review later, some of the things we look for, the anxiety, the low mood, not showing up for class, right? That is where we want to catch them, right? If they're not sleeping well, if they are in some culture, like I'm a South Asian, female, and in my culture, it's very common to complain about headaches or stomach ache or indigestion, or instead of saying, I feel really sad, right? So how to look for those cultural nuances of like, okay, well, you're getting a lot of migraines. What's going on, right? So catching it at a very early on really saves their semester, the heartache, getting them connected to the right services. Do we need medical med management? Do we need to see you more often? Do we need to connect you to off-campus services so that we don't catch them, when they are really, really drowning, right? So the key is like we want to move our students towards thriving so that they are enjoying their academic life. They're feeling the joy. They have the energy to connect with other students, focusing them on solution focused stuff rather than really, students struggling all the time and they're tired and are not sleeping and they're not eating and, struggling with low self-esteem and get towards the hopelessness, which is where most of the high risk services then kick in. So our goal really is to move our students towards this continuum or catch them at the right time. So, I can talk more about the services if you go to the next slides on how we do that. So in order, our goal really is to be proactive and make sure that we provide step care model, right? So we try and do a lot of outreach around these services. So, of course, the very basic one, our bread and butter, is our crisis management services. No appointment is needed for any registered students with health fee paid. They can walk in, they can call us. That's our number. We're open from actually 8 to 5. So I need to update that slide. So we're open from 8 to 5. Students can call us if they have any urgent need. They can also call the same number if they want services after hours, after 5 p.m. That same number, pressing option 2, will get students or their parents or whoever is trying to seek support with a live clinician. So that number is really good for you all to have on speed dial. Especially for after hours, we're always, that line is always available over the weekends, during holidays. So this is a third party that we have contracted, and they're really good clinicians, and they will inform me or the associate director if there is something that we need to step in. So we work in tandem. We also have psychiatry services. It's confidential, included, again, in all our services are included for our registered students. There might be a out-of-pocket cost for copay for medication if they have been given a script. So we have brief time-limited therapy. We offer single session therapy. Next slide. We also have gender violence intervention services. We have a coordinator specially for that, for any students who have experienced recent any kind of violence. any domestic violence, any assault, relationship violence. We are quite capable of offering support through that. And then campus outreach is a big piece of, any counseling center. It's really to go out where students are, because I know that not every student is going to walk into our campus, to our counseling services asking for services, right? Students who come from cultures where there is a high stigma of mental health, help seeking, just like my own, they would never do that. So we have special programming for them. We do workshops, we go to the classes, we work with the identity centers, we may work with the faculty training on like teaching them how to do a warm handoff. We go to the schools and do some liaisonship. And then we have drop-in consultation, which is very low barrier. We don't ask for any demographics. It's literally, we're here. How can I help you? How can I answer your question? So that is very important service for us. Next slide. And so this is just reiterating, we have the same day services, from 8 to 5. Again, I apologize. I need to change that. And then we have the after hours phone line. Next question. Next slide. Sorry. And then we have timely care, real quick. This is also a service that we provide to all our students. They get up to 12 counseling sessions included in their, if they're registered students. Timely care is amazing because the Talk Now feature is a text. We all know how kids like that. And it is also available. Timely care is available nationally. Talk Now, if our students, registered students, are traveling internationally, they can also do that text. It's a non-clinical. Talk Now is a non-clinical service, but it's really, really supportive to our students. And then they have a really good digital self-care content. Next slide. And this is just, I always add that for parents so that they know who to contact for any local resources. Next slide. Okay, and then I'm going to pass it on to Dr. Sharp.
Perfect. Thanks, Dr. Damani Koja. Good evening, parents. Good evening, families. Thanks for joining. If you're joining us from the morning time, good morning. If you're watching this recording, we're so grateful to have you here, and we look forward to welcome you onto our beautiful campus in less than 30 days. My name is Justin Sharp. I serve as the Senior Associate Dean of Students in the Dean of Students office, and my portfolio includes care and accountability services. One of those that we're highlighting tonight is DukeReach. So when I'm talking with families, talking with students, talking with campus partners, families in particular, I just don't know where to start. My answer is almost always the same. Start with DukeReach. We are your front door to the university. As you have sat through this presentation for about 28 minutes, you have already started to see the incredible challenges sometimes that being a part of a university is, because there's so many resources available. It can sometimes be difficult to know which office to contact or which type of support a student may need at that particular point in time. And that's where my office, where my team comes in, that's where DukeReach comes in. We serve as the front door to student support, and our role is to listen, understand what's happening, and connect students and families to the right people, offices, and resources that we have at Duke. If you're ever reaching out to us, you don't have to have the right answer, whether you're noticing a concern, your student's unsure where to turn to, or you simply just need help navigating the university and all the systems. We can help identify the next step. So once a student connects with DukeReach, what does that support actually look like? All right. So at its core, DukeReach is about helping students find a path forward. Our team provides one-on-one guidance to help students navigate their personal, social, and academic challenges that can come with the college experience that we all know. For those of you that have navigated your own college experience or have seen tangentially the college experience of other family members, we know that challenges rarely happen in just one area of a student's life. So as a personal situation information that comes up, we know that can impact academics, relationships, their overall well-being. So we help students work through those connections. Our role is not to replace any of the experts that you've talked to or that have talked to you on the screen tonight, but it's just to share that resources exist across campus, and we help students identify the need to connect with the right people and understand their option, especially during challenging moments. Whether it's a significant personal circumstance, a difficult transition, or a crisis, like Nadia has mentioned, we help to step in and coordinate and make sure that students are not trying to navigate those challenges all on their own. We work alongside your student, your child, helping them build the confidence skills and the independent skills that they're about to embark on, while also ensuring that they have access to the support systems available to them. So an important part of our approach is that we don't wait for a student to reach a point of crises before support happens. So that's when we're not waiting for them to raise their hand. We know that students typically aren't always asking for help when they actually need it. We're just going to suck it up and we're going to figure it out. And I'm going to do this on my own, but sometimes they may need a helping hand, and that's where my office can come in. They may not recognize that support is actually available, and sometimes they may not feel comfortable reaching out. So our approach at Duke relies on the caring network of everybody that you see on this screen, everybody that you don't see on this screen that is working at the university, that is aware of the role that DukeReach plays on this campus as a connector, to know how our students can be recognized, what to recognize. Dr. Damani Koja mentioned kind of signs of distress. Our campus community is well versed in that. We know what signs to look for. We know what referrals need to be made. So we're putting all of the puzzle pieces together. So faculty members, advisors, residence life staff, coaches, campus partners, and peers are often the first to notice these shifts maybe in behavior. Maybe a student is going to be less engaged, experience a personal challenge, or struggling academically, or simply just not showing up in the way that they normally do. So when a concern is shared with DukeReach, our trained staff reach out proactively, and that outreach is not about making assumptions or telling students what to do, but it's about opening up a door, letting students know that someone noticed, and helping them identify what support might be helpful. We also know that the best support happens when we're working together. So I am in constant conversation with many of the folks on this team here in a best way supportive feature to make sure that we're doing wraparound holistic well-being when it comes to best practices for that supportive concern. That outreach, it's about opening up a door, letting the students know that someone noticed, and helping them identify what support might be available. We also know that families are an important part of that support network too, because you know your child in a way that no one else does. So as parents and family members, you know your child best. You recognize their personality, their routines, and the things that may signal that something just feels a little different. So changing in communication, behavior, the academics, the relationships, or the overall well-being can sometimes be an important indicator that your child may benefit from additional support. So if something feels different, we just encourage you to reach out. You don't need to wait until you have all the information or know exactly what your student needs. But sharing a concern early, something that you've noticed, allows us to better understand the situation and determine how we can support your student the best. Information families provide is incredibly valuable. You have context and history that we may not see from our vantage point, and that helps us approach students with a fuller understanding of what might be happening or occurring. And we also encourage you to remind students that asking for support is a sign of strength and not a weakness, even though during a moment of crises, it may not seem that way. We know that this next step, this embarkation for coming onto campus, is a time when your child is going to learn how to navigate challenges, make decisions, and build resistance on their own, and seeking help is going to be a part of that growth. And finally, before I transition over to Sarah Campbell, stay connected with us. We're not only here for students, but also as a resource for you who have questions or concerns. We can help identify resources, answers questions, work alongside your student to help find a path forward. So you can see on the screen right here, I've listed just a quick Duke version of a bit.ly link that connects you directly to our care referral. This is where we intake information, where we review it, we assess it, we assign it out, and make sure that we're connecting the student as appropriate and help determine the best next step forward. So I'll leave you with, we're here to support your child. We're here to partner with you and help every single student that's about to step foot on this campus in a few short days, help find their pathway forward in a time of need. So I'll pass it over to Sarah Campbell, who, in a continuum of care, helps us on the prevention and the promotion end. And I'll toss it over to you, Sarah.
Wonderful. Thank you so much, Dr. Sharp. Hi, I am Sarah Campbell. I'm the Associate Director for DuWell, which is the Health Education and Promotion Unit within the Student Wellness Center. And I'll share a little bit. I was sitting in a family webinar about a year ago for my own daughter, so I can relate to where you are in your student's journey to their first year at college. And so I'm excited to be here today, tonight, whichever time you're watching this, to help you as you navigate that same process. And so one of the biggest questions that I always had with my daughter was, how is my university or my daughter's university going to help support my daughter's well-being? I might be a little biased because that's the space that I work in, but I want to tell you that I bring that question to my work every single day that I step on campus here at Duke. So you can progress to the next slide. My colleagues and I were really passionate about the ways that we can support students' well-being. And so when we think about student well-being here at Duke, we approach it from a preventative lens. And so as Dr. Sharp said, our goal is not to wait until something goes wrong. We want to give students the tools and the skills and the experiences that they need to take care of themselves from the very start. And so we focus on holistic wellness here at Duke. So not just the physical health, but also educating students about managing stress, building community, navigating social life, establishing healthy relationships, and getting that education to help them make the decisions that feel right for them. You can go to the next slide. So students actually start engaging with us before they even get on campus. Actually, yesterday, they got our first wellness module. And so they complete a wellness module that looks at the 6 dimensions of wellness. And in that module, they reflect on their strengths. They think about areas where they may want to grow over the next year. They create a personal wellness plan and they set some goals, which really helps them come in with a bit more intention. And I think that's such a really unique way to be able to start thinking about how they can build their toolkit for wellness here at Duke. What's also really great is we get to check back in with them at midterm because we know that things shift once classes start, life picks up. And so that gives them the chance to reflect on how those first few months have been going and adjust their goals if needed. Once they get here, the bulk of our work is helping students navigate those real life situations. So that includes things like healthy relationships, looking out for one another through bystander intervention, and really just making generally informed, safe choices in social settings. And so we provide a lot of different opportunities. And I have some pictures here on the screen. So I mentioned the wellness module at Duke, which they're working on. I also meet with every single student during EXO week and present to them on wellness at Duke. So we have the Schmoody app, and that is an app that we launched last year. It is free to all Duke students, and it allows them to log their daily moods, to reflect on the things that might be contributing to those moods, creating daily action plans. So those are customizable steps that allow them to meet their goals. It gives them the option to schedule joy time, which are just joyful activities or hobbies. There's communication support. It's like a text helper that will help them get support for boundaries and self-advocacy. And then they can assess themselves in the different dimensions of wellness. There's a chat bot. And so that's a really cool app that they are going to be able to download free and use throughout their time here. We also will be distributing the Blueprint, which we will give those out on move-in day, actually. So hopefully you'll get a chance to sneak a peek at it. But it is designed, it's a calendar, it is a reflection piece. And so it's designed to support student success, student engagement, and well-being through things around goal setting, time management. There are weekly calendars and reflections and growth hacks. And it's like their own built-in coach here to help them navigate their transition to Duke and build those healthy habits from the beginning. We are also provide workshops, and we offer immersive multi-sensory wellness experiences. And so what that basically means is that we are providing ways that make wellness really easy to engage with. So those are going to be weekly programs, and some of them are a low-key event, some of them are higher scale events. And so some examples on here, we have drum circles. We had a planting workshop where they got to walk out the door with a plant to put in their rooms, but also using that experience to talk about taking care of yourself. We have sound baths. We had glow in the dark yoga, knitting circles. So it's just a lot of different opportunities for students to engage in programming that we know can help reduce stress, can give them a little bit of joy, and connect with other people. We have peer educators that are involved across campus, and they are students who collaborate with other organizations. They work with the residence halls and other campus partners. And we find that peer-to-peer connection really creates a culture of where taking care of yourself and one another is just part of campus life. We have support for students who are in recovery and offer spaces to connect and support them in that, and can also provide additional resources, can connect them with CAPS or community providers if needed. At the end of the day, everything that we do is about helping students build skills. And I forgot to mention the Oasis spaces on campus. Your students should check those out. There's one on East Campus and West Campus. There's aromatherapy and massage chairs and just some ways for them to relax as well. So we are super excited about your student exploring their well-being here at Duke. And congratulations on being 30 days closer to having them transition here.
Well, all right. As y'all can tell, we have a myriad of different resources dedicated to ensuring that your child can have the best experience at Duke, and we're here to support your child in every step of the way. And now, during our last about 15 minutes of the webinar, we are opening up to the Q&A section. So if you have any questions, you can utilize the Q&A feature on the Zoom, and we can plug in your questions, and let's see if we can answer some. Well, while we wait, we have the first question saying, how's the information provided to the student? Let's
Sarah, do you
see.
want to chat a little bit about that, given your engagement with students at EXO?
Yeah, so we will provide information in the wellness module. There's information about how, I believe this question was asked when the presentation was about CAPS. But in general, all of the resources that we have to support student well-being is covered in the wellness module. We also talk about that in our EXO. So we do a lot of talking about how to access resources. We talk about using the resources in the ways to support not only yourself, but the community, right? So building that community culture of care. Within our unit specifically with health promotion, we're on BC. We try to be out there every week, sometimes multiple times a week. So we do a lot of trying to connect students with those resources. And students are very aware of the resources, and you can hear them actually talk about them with one another as well.
Yeah, and so BC is our Bryan Center Plaza. It is the
Yes.
hub of activity and social interaction and kind of the commons, if you will, for those of us who are old enough to remember what a commons is. Dating myself a little bit. we also have, so as we go through those first 6 weeks, we have a wellness week, there's resource fairs, CAPS will be out there, student health will be out there, Duke Reach will be programming, the RAs will be sharing information repeatedly. So one of the things that we know is that there's so much information happening in the first week that students are here that it's just too much to catch it all, right? And so it's repetition over and over and over again via email, via tabling, via programs, sometimes via referral, like Justin was talking about with the Duke Reach structure. So all sorts of opportunities where we're going to keep driving that point with your student through the first, well, through their whole 4 years.
Yeah. And next question is asking about like how can students see a dentist on campus?
Dr. Trost, you want to take that one?
Sure. There is a dental office in the bottom floor of the Wellness Center. It is run by a program, Campus Smiles, and that information, I believe, is on the Student Health website, the Student Affairs website, and they do have a program for those that do not have dental insurance and kind of support care that way. And they also take some insurances that are an option. I don't know if maybe anybody else has added details for that. And there are, of course, several community dentists.
Absolutely.
We have another question. Let's say your child needs to see a doctor before getting a new prescription of medicine. How can they do that?
In particular, Dr. Cho's Accutane or other medications that need to be seen with a provider regularly for medication prescription. How do they bring that over to Duke?
Yes, so Accutane is a particular case example. Accutane requires that the doctor prescribing that be part of a registry and track certain things. I'm sure this person is aware of that. That's what they're asking about. We do not provide Accutane at Student Health. We are not part of that registry and we do not do that. However, if a student is receiving that medication from their home provider and their home provider just wants them to come for instance, there's pregnancy testing, cholesterol checks, some various laboratory work. Our lab does draw outside labs for outside clinicians. The prescribing provider writes a prescription for those labs, provides it to the student, and the student can make a laboratory appointment to get that done. Those labs go to LabCorp and then are faxed back to the ordering provider. So it sort of circumnavigates our or bypasses our system. However, if their home provider does not feel comfortable with continuing to follow them while they are out of state, ordering those labs, then the student can come to Student Health and we will work to arrange for the local referral connection to the local dermatology offices. And there are other instances where a person may need something from their home provider. Perhaps they came home for fall break and they had a visit and they said, okay, we want to do these follow-up labs in a month. If that provider, again, just gives the student a prescription with orders for whichever labs, then the student can take that to our lab and have those done, and then it just bounces right back. If a home provider wants to warm hand off a case or ongoing care to our team, that is something we do all the time. And the student can bring information, provide a release of information for their home provider, transferring notes and care. And we often have cases where while the student is on campus, we are managing and following a person, and then we summarize and hand back to summer care or perhaps a study abroad, various things like that, where we work to coordinate care for a student.
All right, that's good. We have another question, or actually a couple questions asking about healthcare proxy documents and and what does that process look like? Is there a waiver that, parents sign to, get access about their student health, or is there a it,
Yeah, so I'm hopeful. One of our nurse manager is behind the scenes right now, and I'm hopeful that our nurse manager can get on and put the link. I think that we have a link to upload those health proxy information.
We do, and I'm going to jump in with a little bit of extra information on this question. So, this is the big transition, right? As your student becomes a capital A adult in the eyes of the law, and there's two parts. And so I'm going to ask Dr. Sharp to jump in as soon as I finish part one. But part one is really our goal over the next 4 years is to help your student become an advocate for their own healthcare, right? To grow into understanding how to navigate a medical provider's office, how to use their insurance card, how to check in and answer a health history. So we're really working and growing with them and how to be able to interact and engage with the provider and do that piece with ownership. And as you've heard from all of the team here, we're very focused on students. We're very developmentally oriented to helping them grow as they navigate the next few years. So there is a document that we can share for, and students can upload this information into MyChart, which is the electronic medical record system that we use. Those links and that information is available on the Student Health website. Keep in mind a couple of things. One, healthcare proxy documentation only becomes active when a student is not alert and oriented. We certainly hope that is never the case. In that event, it needs to be an EPIC because it's the hospital emergency department that needs it, not student health. And we're not able to send the documents elsewhere. We really want it in EPIC. Also, as parents, you're the automatic next of kin. So unless there's a spouse, parents are the next of kin. So that is an automatic piece, but certainly a healthcare proxy document doesn't hurt. So please know that that is available. We will work with the student. We want them to drive and choose who the support persons are who are involved in their care. We encourage them to have support persons. We encourage them to connect with family or friend or whoever their loved one is as an emergency contact. So we will encourage them, but we also will require that they're driving that and that others are not able to call in and just get information about the student without the student being involved, because that's part of that growth and that ownership and that health, the advocacy for their own health and well-being and getting to make the choices about what they feel best within their healthcare. Now, all of that said, a really important piece of this is what I want to ask Justin to talk a little bit about, which is what happens in an emergency when we're navigating something and we really do need to get support from a family member or emergency contact.
Yeah, absolutely. So another portion of my portfolio is overseeing our 24/7 crisis response, Dean on Call. So this is a staff member that serves in a 7-day rotation, 24/7 nights and weekends that help support urgent and emergent needs, but also a piece of that role is to contact emergency contacts and families if and when a child is in the hospital due to an accident, a serious injury. So we are that relayer of information to make sure that you are well aware what is going on, and you're getting that information as soon as we can deliver it. So that is one way that we continue to fold you into this to make sure that you're aware, especially when it comes to the health, well-being, and safety of your child.
All right, yeah. Thank you. Um, let's see any more questions in the chat. We do have a couple more minutes, so anyone wants to ask more questions in the chat. We do have a question in the Q&A section asking about medication. So this person asking where to send medication if someone needs it on a bi-weekly basis, and medication needs to be kept room temperature and includes needles. So if you can answer that question, also general questions about how do we, set up sending medication to do pharmacy and such.
Yeah, so for a medication that's room temperature, That should be something that the student would be able to keep in their space. We certainly can provide recommendation, on securing sharps and what to do with sharps. What I would recommend in that situation, because every medication, as Dr. Trost has kind of talked through with some of the various things and pathways and the if-then she's talked about in some of these things, I recommend that you reach out to our student health team directly with whatever the specific medication is, whatever the situation is, and the ask to speak to a nurse. That team can really help based on your student's specific medication and situation to give guidance on storage, safety, recommendations for the room, etc. And perhaps, sorry, I know that there was a second part to the question. Maybe Dr. Trost, we want to talk about how students can send prescriptions to the local pharmacy or transfer over to the campus center pharmacy that's downstairs in the first floor of the Wellness Center.
Certainly. So the campus center pharmacy is a fully functioning retail pharmacy. Any provider can send prescriptions to Duke Campus Center Pharmacy. Most electronic health records, if you just start typing Campus Center, Duke Campus Center Pharmacy, it'll auto-populate. And if the student chooses to have that be their pharmacy, just scripts can be sent there and the student can pick it up. There are also a variety, obviously, of community pharmacies, and understanding what, if you don't have the student insurance policy, whatever your insurance policy is, and what their pharmacy benefit manager is, because sometimes they prefer that those prescriptions get sent to a Walgreens or a CVS or et cetera. So just understand what your policy is and have your provider send that to the correct or more economic pharmacy. We will also always ask students that see us when we are sending prescriptions, try to understand what their most economic policy is. It is often a balance of convenience and economy to go and use our pharmacy on the first floor. But sometimes if a student is, using the Costco membership and doing the snack run, they will also pick their scripts up at Costco, and that's perfectly fine.
Pretzels and popcorn in bulk. You can't go wrong.
Yes, sounds good. Thank you for answering that question. We have a couple more minutes left. So, if anyone has any last minute questions that they want us to answer, um, now is the time.
Yeah. And while we're waiting for any final questions, I just really want to reiterate that you all know your student better than anyone. We are here to be of service to your student, to help them grow, to help them learn, develop lifelong well-being skills, and to make the most out of the Duke experience. But you are the one who knows them best. And so if there are questions, if there are concerns, please don't hesitate to reach out, whether it's in 30 days when you're coming to campus or in 3.5 years. We're here through that journey. So looking forward to getting to see you all in Fall Family Weekend and throughout your students' time at Duke.
Mm. Yeah, I believe the question about Accutane, I'm pretty sure the D pharmacy does not personally does Accutane, but if Dr. Rush want to correct me.
Yes,
Yeah.
as a prescription, it
Mm.
can be picked up from the campus pharmacy. The front-loaded parts of the prescription go through whichever dermatologist is doing that.
Yeah, well, all right. Well, any more questions? Thank you so much for our campus partners for joining us this evening. Once again, they're here for you and for your child, not only in the beginning, but throughout their Duke experience and in the end as well. So thank you very much for all the information. Please reach out if you need anything. They're always here for you. And thanks so much for joining us today. And I hope you guys have a great rest of your Thursday evening. Have a great weekend. So. Without further ado, I think we did a great job here, y'all. And yeah.